Good evening, Dr. Charles and class. Today I will be discussing health disparities of minorities living in North Carolina. Health disparities and inequities has plagued individuals living in poverty-stricken communities for years. It is because of these disparities and inequities that citizens living within poor communities witness an increase in the prevalence of chronic disease, illness, and deaths. Factors contributing to these disparities include race, gender, income, and the geographical region in which an individual resides. Despite the efforts of the Affordable Care Act to decrease the number of individuals living without health insurance, there are still many whose accessibility to adequate health care is a much deeper issue than obtaining basic health insurance coverage. As of 2016, North Carolina was found to be the home of some 10 million citizens, with 22% being African American and 9% of Hispanic Latino descent. North Carolina Department of Health and Human Services 2018. Of that 10 million, a significant number of minority communities reveals risk factors that contribute to a high prevalence of disease and illness. Considering the risk factors associated with health disparities attached to minority communities in North Carolina, African Americans and Hispanic Latinos rank the highest in unemployment, teen pregnancy, HIV, homicides, and lack of health insurance. North Carolina Department of Health and Human Services 2018. Research conducted by North Carolina Community Health Partners and Winston-Salem State Ethnic Research Center, in partnership with North Carolina Housing Authority, provides a broad overview of how health disparities has negatively impacted minority communities and the risk factors associated with the prevalence of HIV for minorities residing in North Carolina. The purpose of this paper is to discuss the epidemiology of minority communities in North Carolina, the prevalence of HIV within those communities, and the needs of these communities that will promote positive change in the future. The CDC considers lack of early detection and the health disparities of Black communities as contributing factors in the gap of prevalence and mortality among various ethnicities. Communicable diseases reflect a high degree of prevalence in minority communities, with drastically higher numbers seen in the African American community than in any other ethnic group. The North Carolina Department of Health and Human Services describes communicable diseases as an illness created by an infectious agent or toxin and is transferred by an infected individual to others. North Carolina Department of Health and Human Services 2018. A report created by North Carolina Department of Health and Human Services from research conducted between the years 2004 and 2008 shows that the prevalence of HIV in the Hispanic Latino population was 3 times that of the white population, and that the African American population showing 3 times more cases than Hispanic Latinos. North Carolina Department of Health and Human Services 2010. Of the male population, African American men ages 13 to 29 represent the highest rate of new HIV diagnosis each year, with an estimated 78 new cases per 100,000 citizens. North Carolina Department of Health and Human Services. African American women also project the highest rate of new HIV cases for North Carolina at a rate of 17.7 cases per 100,000 citizens, with 52% of the overall female population being diagnosed over the age of 40. It was not surprising that the African American community represents the highest prevalence of HIV cases. However, it was shocking to find that women over 40 represent 52% of the new HIV cases in North Carolina. There were 518 HIV-related deaths in North Carolina in 2018, with 62% of those deaths being from the African American community. AIDS VU 2020. So now we want to discuss the community needs assessment. So from July of 2018 to September of 2018, the North Carolina Community Health Partners and Winston-Salem State University Ethnic Research Center, in partnership with the North Carolina Housing Authority, conducted a needs assessment to gain insight into the increase in HIV cases among minorities in North Carolina. Other participants, including residents from three of the large government housing communities in the counties of Mecklenburg, Forsyth, and Guilford in North Carolina. There was also participation from students at Winston-Salem State University, which is located near low-income communities in Winston-Salem. Methods used to gather information for this assessment included written surveys, one-on-one interviews, and community focus groups. Of the three large government housing communities in North Carolina, 100 surveys were handed out in each of the three communities, with a total of 75 being completed and returned. The college campus of Winston-Salem State University also received 100 surveys, with 60 being completed and returned to the Dean of Ethnic Health Studies. 3 focus groups were formed, one for the students at Winston-Salem State University and one for each of the 3 housing communities in North Carolina. There was a total of 50 participants in the focus groups, including 20 participants from Winston-Salem State University and 10 from each of the housing communities that were a part of the needs assessment. The strengths of the assessment can be attributed to the assistance of Winston-Salem State University for permitting resident advisors to hand out surveys to students and flyers to be displayed in the campus common areas such as the cafeteria, library, campus mail center, and infirmary. An additional strength is from the donation of funds by Winston-Salem State Ethnic Research Center that allowed financial compensation for individual participants, as each participant received a $10 Visa gift card. Winston-Salem State University also hosted the focus group on campus for students participating in the survey. Also, the North Carolina Housing Authority allowed access to gated housing communities, allowing surveys to be passed out door to door at each government housing location. One noted limitation is the lack of participation from citizens living in government housing communities. Another limitation was finding a secure location near those communities for those living in government housing, as these are high crime areas, with most residents relying on public transportation. Surveys among government housing participants reveal frequent sexual activity with little to no contraception. More males reported little to no use of condoms during sexual intercourse with one or more partners. There are currently a large percentage of Black males living with the HIV virus, which proves they are the individuals most susceptible to contracting the disease. North Carolina Department of Health and Human Services, 2016. There were no findings for homosexual tendencies among Black males who participated in the survey and live in government housing. All Black males responding to the survey within the government housing communities report no desire or participation ever in homosexual behavior. Women living in these communities who participated in the survey revealed 60% condom usage with the same partner. The remainder report little to no condom usage with the same partner. There is no homosexual activity. However, 75% of the participants state that they are related to or know someone who is HIV positive. Surveys completed by 20 students at Winston-Salem State University reveal steady and casual sex partners with the same partner over a 12-month period. Some of the male college students did reveal protected homosexual encounters with individuals that they met either on campus or in a social setting where there was a strong homosexual presence. Reasons for high-risk sexual behavior among young African Americans are stated to be There are very minimal messages on prevention that appeals to Black communities. Most believe that contracting HIV for them is personally impossible. They feel like they prevent it in many ways so that they can't catch it. And basing one's physical appearance as being HIV negative, so many of these individuals feel that they can classify or determine who is HIV positive simply by physical appearance. Recent epidemiology has found no positive HIV cases on campus of Winston-Salem State University, with approximately 50 students being tested a month to combat trends. Hinton, 2012. The benefits of the focus group gave a more in-depth investigation about individual personalities, personal opinions, and behaviors of African Americans living in low-income communities or predominantly Black college campuses when it comes to HIV facts. The 4 focus groups combined had similar opinions about HIV, stating individuals with HIV are easily detectable by outwardly appearance, and that gay men are likely to be the ones to contract HIV than any other group. Recommendations for low-income government housing communities and African American college students include increased public health programs that will provide education on HIV prevention and the importance of contraception. Also, community health centers community healthcare centers are needed to provide free HIV screenings, unlimited free condoms, and correspondence that will educate communities on positive changes to improve their physical health and increase HIV prevention. Continued efforts of prevention at Winston-Salem State University include establishing programs in conjunction with the National Black HIV/AIDS Awareness Day, which can also assist communities with educational resources on prevention. Excuse me. Funding these communities with an estimated $300,000 to $500,000 per community is needed to accomplish the goals of bringing awareness and prevention methods to these communities. In conclusion, health disparities and the high prevalence of HIV/AIDS in low-income minority communities can no longer be ignored. Considering the disproportionate rate of diagnosed HIV cases among Blacks in comparison to the number of cases found in predominantly white communities provides evidence that there are health inequalities affecting the physical health and well-being of minority communities. There's a great need to increase public health programs, improve the socioeconomical status of the individuals living in these communities, provide accessible health care in close proximity to minority communities, and increase awareness and prevention through education. With the implementation of these positive changes within minority communities, we can decrease the number of HIV cases affecting the countless Black males and females of these communities and potentially eradicate the presence of HIV altogether. Thank you for your time. I hope you enjoyed the presentation.